We orthopedic surgeons receive a lot of patients in our OPD who come with complaints of shoulder pain, shoulder stiffness, and difficulty in lifting their hands above the level of their shoulders. Good morning, good afternoon, and good evening, viewers. I am Dr. Rajit Matthews, your joint replacement and arthroscopic surgeon, talking from Sri Narayani Hospital and Research Center, Vellore. Today, let me take you through the most commonly discussed topic, stiff shoulder, or periarthritis shoulder, or frozen shoulder, also known as adhesive capsulitis. What is stiff shoulder? When the patient comes to you with complaints of pain and difficulty in lifting his or her own hands above the level of the shoulder, we usually diagnose it as stiff shoulder. The three main causes for stiff shoulder are history of trauma or fall, diabetes mellitus, and thyroid dysfunction. Our shoulder joint consists of a ball and socket joint. The ball is the humerus head and the socket is the glenoid cavity. Our shoulder joint are stabilized by stabilizers. These stabilizers are broadly divided into dynamic stabilizers and static stabilizers. Dynamic stabilizers are otherwise known as rotator cuff tendons, and they are broadly again divided into supraspinatus, infraspinatus, teres minor, and subscapularis. The static stabilizers are broadly divided into glenohumeral capsuloligamentous complex, and they are again further divided into superior glenohumeral ligament, middle glenohumeral ligament, and inferior glenohumeral ligament. To note, any pathology or any disease condition that leads to stiffness or contracture or tightening of this glenohumeral capsuloligamentous complex can lead to something known as a stiff shoulder. Let me walk you through the main common etiologies which lead to stiff shoulder. The most common being a history of trauma or fall. A person falls down, he sustains a fracture, and due to the pain, he is not able to lift his hands above the level of the shoulder. Secondly, diabetes mellitus or insulin dependent diabetes. Thirdly, thyroid dysfunctions. Fourthly, any inflammatory condition of the shoulder like rheumatoid arthritis, osteoarthritis, tuberculosis, SLE. Any infective conditions of the shoulder joint, including any infections secondary to bacterial etiology, viral etiology, and very unlikely a fungal etiology. Last but not the least, prolonged immobilization. When a patient is suffering due to cardiac issues or due to brain injury and he is immobilized in bed for a long period of time, that can lead to something known as shoulder stiffness too. Now, when the patient comes to our outpatient clinic, what we do is we ask him the complaints and ask him what exactly is restricting his daily routine activities. He usually says that it's pain and difficulty in lifting his hand above the level of the shoulders. As soon as we hear this, we run a battery of tests. Investigations most likely include a series of blood investigations. First, if you are a diabetic, we check your diabetic levels. If you have a thyroid problem, we check your thyroid levels. Thirdly, if at all we suspect an underlying infection in your shoulder, we again run few more blood tests. And then second in line, we run x-rays to check the bone density and how good your bone quality is. Last but not the least, coming to the use of an MRI scan. An MRI scan usually gives 90 to 93% confirmation of knowing what is going on inside your shoulder joint. It gives us a good clear view of your bones, tendons, ligaments, muscles, and also your nerves. Coming to the treatment protocol. Once the patient comes to us and we have diagnosed a stiff shoulder, we start them on painkiller medications, otherwise known as non-steroidal anti-inflammatory drugs. And secondly, we start them on physical medical rehabilitation or physiotherapy. The golden words are physiotherapy. This is the most effective treatment for stiff shoulder. This protocol goes on for 3 to 4 weeks. After 3 to 4 weeks, again the patient comes back to us. If yet the treatment has not been successful, we may or may not use an intra-articular steroid injection which can bring down the pain and inflammation in his shoulder joint, and thereby after that we will continue him on physical medical rehabilitation. Thirdly, again, if yet the treatment has not been successful, we take the patient under sedation to the operation theatre and we manipulate his shoulder joint and try to break all adhesions. Last but not the least, up to date, we have the arthroscopic pan-global release. That is, using minimal invasive techniques, using the guidance of a camera and a TV, we go inside, check out what is the pathology in your shoulder joint, and we release the tight adhesions and the contracted and tight capsuloligamentus complex. And after that, we again start the patient on physical medical rehabilitation and help him to attain a complete range of movements. Here, we treat you well with a complete guarantee, and we always give our 100% to you. Our elderly population has paved the way to our future and has laid down the life and the ways to be followed for us future generations. Now, we, the younger generation, it is our responsibility to be with them at this time of their pain and helplessness and give them the best treatment possible. Stiff shoulder is a very debilitating condition, usually affecting the elderly population, and timely care has to be given so that the patient or the elderly population can get over their pain and live a better life, which in turn affects the life and the health status of an entire family. I hope this small talk has given you an insight as to what is a stiff shoulder, what can be done, how to diagnose a stiff shoulder, and how to take it forward. We at the Narayani Hospital will treat you well and give your elderly loved ones the best treatment possible. We will give you our 100%. If at all it is not possible for you to reach us, kindly contact your nearby orthopedic surgeon, run the battery of tests, get the diagnosis, and then give them the right treatment. We, the orthopedic department in Sri Narayani Hospital, started 20 years back with basic emergency and trauma care. Today, in 2021, we have subdivided our orthopedic department into many subspecialties: spine pathology and deformity correction unit, joint replacement and arthroplasty subspecialty unit, which deals with primary joint replacement, primary complex joint replacement, and revision joint replacements. Thirdly, we have the sports medicine and arthroscopic subunit, which gives you a complete treatment to your shoulder, hip, knee and ankle joints using minimally invasive techniques. We also have a pediatric orthopedic subspecialty, and last but not the least, we have a 24 hours into 7 emergency and trauma care unit. A word of caution during this COVID pandemic time. I really don't think it is any worth keeping on blaming our governments and health authorities. We together have fought the first and the second COVID wave. Together, let us be prepared for the upcoming third COVID wave. We, as responsible citizens of this beautiful country, I humbly request you to vaccinate everybody and get vaccinated. Maintain social distance. Wear your masks correctly. The golden word is correctly, covering your mouth and your nose. And last but not the least, do not lose hope. Do not get stressed out. Do not take strain. Hope for a better future. We will fight this pandemic together till we hoist the flags of victory, and we will have a happy future together. That is a hope. Signing off, yours Dr. Rajat Matthews. Till we come on another episode, remember, stay home, stay safe. Thank you one and all. Jai Hind.